30 million Americans woke up this morning without health insurance. Not because they forgot to pay their premiums, not because they lost their jobs, but because a single pen stroke erased the healthcare safety net that protected them for over a decade. The Affordable Care Act is gone, vanished. And what happened next is a nightmare that medical experts are calling the greatest self-inflicted healthcare catastrophe in modern American history. Sarah Johnson is staring at a pharmacy receipt that might as well be a death sentence. Her 8-year-old daughter Emma has type 1 diabetes. The insulin that kept Emma alive cost $47 a month under their old insurance plan. Today, without coverage, that same vial costs $436. Sarah's hands are shaking as she does the math. Her family makes $38,000 a year. They can't afford to keep their daughter alive. This is not about politics. This is about the moment when ideology crashes into human biology and human biology always loses. Emma Johnson is not a statistic. She's a third grader who loves unicorns and wants to be a veterinarian when she grows up. But right now, her mother is Googling how to ration insulin, because that's what America has become in the span of 24 hours. The insurance companies moved faster than sharks sensing blood in the water. Within hours of the ACA's repeal, rejection letters were flying through email inboxes across the country. Pre-existing conditions, that phrase that sounds so clinical and harmless, became a death sentence for millions. Diabetes, heart disease, cancer survivors, asthma, even pregnancy, all suddenly became reasons to slam the door shut on coverage. But Sarah Johnson's story is just the beginning. Drive 3 hours west to the small town of Clearwater, Nebraska, population 2,417. The Clearwater Community Hospital served this farming community for 63 years. Today, there's a handwritten sign taped to the emergency room door that reads, "Closed indefinitely." Nearest emergency care, Lincoln General Hospital, 127 miles east. The hospital's CEO, Dr. Patricia Wells, is sitting in her empty office explaining to a local news reporter why they had to shut down overnight. 60% of their patients were insured through ACA marketplace plans. When those plans evaporated, so did 60% of their revenue. You can't run a hospital on air and good intentions. The ripple effects are spreading like cracks in ice. In Clearwater, if you have a heart attack, you now have a 127-mile journey to survival. If you're in labor, you better hope your baby waits 3 hours for the drive to the nearest maternity ward. The town's only ambulance driver, Mike Rodriguez, is driving routes that would have been unthinkable just days ago. He's watching people die in the back of his ambulance because rural America just became a medical desert. This is the human cost of ideological warfare. Each statistic represents someone's grandmother, someone's child, someone's future that just got canceled. The experts warned this would happen. The medical community screamed from the rooftops that you cannot simply tear down a healthcare system without having something to replace it. But those warnings were dismissed as partisan fear-mongering. Now, those fears are walking into emergency rooms with symptoms that could have been treated with a simple doctor's visit if they still had coverage. The Johnson family is not alone. Across America, 30 million people are making impossible choices. Do you buy your heart medication or pay rent? Do you get your cancer screening or keep the lights on? Do you refill your child's asthma inhaler or put food on the table? These are not choices that should exist in the world's wealthiest nation, but they are the reality for millions of Americans right now. The emergency rooms in major cities are beginning to crack under the pressure. Hospital administrators are watching their uncompensated care costs skyrocket as desperate people pour through their doors. These are people who avoided seeking treatment until their conditions became life-threatening because they knew they couldn't afford it. The system is buckling. Nurses are working double shifts. Doctors are making decisions about who gets care based on who can pay. This is not medicine. This is triage in a war zone. Meanwhile, health insurance company stock prices are soaring. By eliminating their sickest, most expensive patients, their profit margins have exploded overnight. The same companies that spent millions lobbying for this moment are now celebrating record quarterly projections, while children like Emma Johnson count their insulin doses like a miser counting coins. The international medical community is watching in horror. Dr. Hans Mueller from the World Health Organization called this an unprecedented act of healthcare self-destruction by a developed nation. Countries that America once lectured about healthcare access are now offering to send medical aid. The tables have turned, and America is no longer the teacher in the room. But the real horror story is just beginning. What happens when a nation deliberately dismantles its healthcare infrastructure is not just individual tragedy, it's social collapse. The pharmacies in low-income neighborhoods are seeing something unprecedented. People are buying insulin vials and breaking them into smaller portions to share with neighbors. They're creating underground networks of diabetics sharing supplies like Prohibition-era speakeasies. This is America in 2025, where staying alive has become a black market economy. The Johnson family's story takes a darker turn. Sarah has joined a Facebook group called Insulin Angels, where parents of diabetic children coordinate cross-border trips to Canada and Mexico to buy affordable medication. The group has grown from 50 members to over 12,000 in just 2 weeks. They're planning convoy trips, carpooling across international borders like refugees fleeing their own healthcare system. Sarah Johnson, a small-town bookkeeper from Ohio, has become a medical refugee in her own country. The psychological trauma is spreading faster than any virus. Dr. Rebecca Martinez, a psychiatrist at Cleveland Clinic, is seeing something she's never encountered before: mass healthcare anxiety disorder. People are having panic attacks in grocery stores, afraid to engage in normal activities because they know a single accident could bankrupt them. Parents are keeping their children indoors, terrified that a broken bone could mean financial ruin. The fear is paralyzing entire communities. Emergency rooms are becoming war zones. Dr. James Patterson, an ER physician at Atlanta General, describes scenes that belong in a third-world disaster zone, not metropolitan America. Patients are arriving with infections that should have been treated weeks ago but festered because they couldn't afford a doctor's visit. He's seeing diabetic comas that could have been prevented with regular insulin. Cancer patients are coming in with tumors that have grown unchecked because they couldn't afford oncology care. People are dying from diseases that were completely treatable just months ago. The economic devastation is spreading like wildfire through communities. When the Clearwater Hospital closed, it wasn't just a medical facility that disappeared. It was the town's second-largest employer. 237 jobs vanished overnight. The ripple effects are destroying local businesses. The medical supply company that served the hospital is laying off workers. The restaurant across the street that relied on hospital staff and visitors is closing. The gas station that serviced ambulances is cutting hours. An entire economic ecosystem built around healthcare is collapsing. This is happening in hundreds of small towns across America. Rural hospitals are dropping like dominoes. The American Hospital Association is reporting that one rural hospital is closing every day. These aren't just buildings shutting down, they're communities losing their lifelines. When a hospital closes in a small town, property values collapse, businesses flee, and the town begins to die. What was once the heartland of America is becoming a healthcare wasteland. The political response has been deafening silence. The same politicians who promised a better plan are nowhere to be found when reporters try to ask about Emma Johnson's insulin or the closed hospital in Clearwater. Press conferences are canceled. Phone calls go unanswered. The architects of this disaster have vanished like ghosts, leaving behind only the wreckage of 30 million American lives. But perhaps the most chilling aspect of this catastrophe is how quickly it normalized. Within 3 weeks, news outlets stopped running stories about individual families losing coverage. The mass suffering became background noise. America's capacity for accepting the unacceptable kicked in. The Johnson family's struggle for insulin became just another story in a nation that had grown numb to its own citizens' pain. International healthcare experts are studying this American experiment in real-time destruction. Dr. Chen Wei from Beijing Medical University is documenting the collapse for a research paper he's tentatively titled The Anatomy of Healthcare System Suicide. His preliminary findings suggest that what's happening in America will be studied in medical schools for decades as a cautionary tale about the intersection of politics and public health. The insurance companies are not just profitable, they're obscenely profitable. By eliminating their most expensive patients, they've created a business model that maximizes profit while minimizing actual health care. Their executives are receiving bonuses that could fund entire hospital systems. The same week that Clearwater Hospital closed, Anthem CEO received a $47 million compensation package. The mathematics of American healthcare have become perfectly clear. Human suffering equals corporate profit. And still, the Johnson family wakes up every morning and counts Emma's insulin doses. Still, the empty emergency room in Clearwater sits silent while people drive hours for care. Still, 30 million Americans go to sleep each night wondering if they'll be able to afford to stay alive tomorrow. This is not a policy debate anymore. This is a humanitarian crisis. This is what happens when ideology meets human biology and ideology refuses to blink. This is America, 2025, where the right to life, liberty, and the pursuit of happiness depends entirely on your ability to pay. And for 30 million Americans, that bill just came due.